Hello, colleagues. This is Steve Superi. I've been given the honor to present what I consider to be a portion of the history of the concept and application of essential public health functions. That portion which emerged from an effort in WHO headquarters back about 1997-98. The purposes of this presentation are to share the origins within WHO, to discuss the nature of EPHF as defined here and there globally, internationally, and to share a small case study of the application of it in one country, that being Indonesia. The EPHF concept was emerging from a variety of locations back in the 90s, and in particular, the situation in the newly independent states of the ex-Soviet Union with regard to the deterioration of public health drew attention to the need for refurbishing, re-strengthening basic public health. Interestingly, a number of major donors were pushing for health systems reform, downsizing, decentralizing, and privatizing. EPHF was therefore an attempt to identify public health priorities for governments in the midst of that rapid reform. As you'll recall, back in those years, there were a number of epidemics occurring throughout the country, many of them in Central Asia and the NIS, but not all. There were problems in Africa, Nigeria being one. There was food poisoning occurring in a developed country of Japan. Nevertheless, the accumulation of these various, presumably independent health crises helped draw attention to the need for reestablishing basic public health. At that time, there was an effort inspired within WHO headquarters to look into how to strengthen various components of the Health for All initiative, the Health for All program and strategy. And one of those turned out to be a small technical working group dealing with essential public health functions. I don't know exactly how the subject came to be in that program, in that agenda, but it was easy to gather together public health professionals mid-level from various programs who could contribute to the derivation of what eventually would be voted upon globally as the core set of essential public health functions. Part of the process, therefore, after initiating the list from within the organization, was to engage a number of national public health leaders to participate in a Delphic survey. And it was the survey itself that was published in the World Health Statistics Quarterly, which doesn't exist anymore. And the process of that survey was given the limelight. A bit of backstory to the formulation effort was that a small team was assembled as a part of the larger HFA effort. They were a very active group, very vitally interested in not only their own program area, but the subject of public health itself. And through the help of the regional offices, we were able to involve as many as 145 national public health leaders who reviewed the product, and through the rounds of surveying in that process were able to arrive at a prioritized list of about 36 essential public health functions and services. The hypothesis that backed up this was the belief that certain public health work is essential because it provides cost-effective protection effectively against preventable and controllable diseases and hazards, and that it would be possible to define such functions specifically enough to enable each country to decide for itself how these functions are to be defined and performed in their system. There were a number of criteria provided, and I'll mention them quickly here, that the essential functions prevent epidemics and the spread of disease, protect the population against environmental hazards, prevent injuries, encourage healthy behavior, respond to disasters, assures quality and accessibility of essential health services, supports healthcare management planning and evaluation, and supports and manages resources, including finance, human resources, and technology. I'm going to skip over most of the details of the content of the product, except to mention that because of the prioritization process and the several rounds of voting that the Delphic panel went to, certain of the services and functions rose to the top very quickly. And I think it's worth noting what these are because they represent, I think, a true consensus across many countries of different levels of development. Basically, the top service is immunization, agreed by everybody. But then monitoring morbidity and mortality, disease outbreak control, and disease surveillance were separated as specific functions worthy in their own right of being given a high score. The promotion of community involvement in health was high up there, number 5. Monitoring the determinants of health was 6. And then we get into the environment, production and protection of safe water, control of food quality and safety, providing health information, education, and evaluating the effectiveness of health programs and services. That rounds out the top 10. We have here a list of additional functions which are there to show the wide range of subject matter, but also to point out some characteristics of this list. There are not a lot of services in here. Mostly these are actions taken to monitor change and to promote healthy lifestyle and health protection rather than simply responding to the ill health that does occur. However, maternal health and infant and child care were 2 of the services that were deemed public health functions. Now, after the assembly of the prioritized list, the working group went a bit further to define a small strategy that they thought would be useful in follow-up to this. And that included allocating responsibility to the associated programs to develop, test, and apply rapid assessment tools for the performance of essential functions in countries, and then to develop programs that could create practical approaches for strengthening those functions when gaps in performance were determined. However, as happens in all organizations, the leadership in WHO changed. Many of the high-level assistant directors general were rotated or changed, and the promotion and support needed to carry this across the program level did not take place in headquarters after 1998. There were other efforts around the world related to the definition of essential public health functions and their application for guidance to national systems. One grew out of the Future Public Health Report developed by the Institute of Medicine and resulted in the formation of an essential public health function steering committee and working group by HHS and supported by CDC. But the regional offices of WHO also got engaged in this, and in particular, PAHO and WEPRO were leading the effort, followed by AFRO and SIERO, and they continued with the definition and promotion of essential public health functions and, to some extent, designing assessment tools. Finally, PAHO in 2000 introduced the concept to the World Federation of Public Health Associations in Beijing, and I participated in that, where the concept was shared and they placed it in their platform. I'd like to make one observation at this point. When you look at the different lists and sets of essential functions as defined by these different groups, there are distinct differences that can be noted. Not that any are out of touch with reality or better than others. It's just that they're different, and we need to recognize that. Many of the U.S.-based efforts, including PAHO's for that matter in the Americas, were more of a managerial nature and defined standards of, for example, standards of health department performance in the management of public health. The distinction that I'd like to draw is that the list that emanated from the work in Geneva was focused principally on services. Services in the sense of public health services and to some extent client care. And there is a distinct difference between the two when it comes to implementing the approach to placing them in action. Let's see, this is the one that was developed by Health and Human Services. And you'll notice that while there is certain public health character to each of these, they're by and large more managerial and organizational in nature.